And here we go. Good
Perfect.
morning, everybody. And we are live. Good morning, everybody. It's Ken Stearns. I am the host of the JAR Foundation podcast, where we talk about all things mental health related. I'm also the creator and the host of the JAR podcast, which is just kind of a informal sit down and we chat about questions in the jar. I've got 444 questions about life packed into this jar, and I'm traveling around the country meeting people, and that kind of led me to this mental health awareness, really, that I didn't know the state of mental health across the states, and so many of my guests have overcome and gone down these roads of real tough mental health issues, and it surprised me, and so I kind of got this idea together to bring people in. Really, the idea is to start a foundation, a nonprofit to help with mental health, to see what I can do in my little corner of the world. And also then the idea was to build something. I really don't know what I'm doing. I'm not a professional. I'm not in the industry. So I'm finding people like Bill Dean that have been around, been in the industry, been doing this, grinding for years, to come on and share their story with me, so I can learn quite a bit. And then also, I think for the audience, if you're in the mental health space, you can see what's going on from other professionals, um, like Bill. Welcome to the show, Bill. Thanks for coming on. We got 30 minutes. Let's get going. Who are you? What are you doing in this space? What do you hope to accomplish, and all that good stuff? And we'll just throw a little bit in there, personal stuff, and then we'll kind of chit chat.
Yeah, no, it's great meeting you, Ken, and it's exciting. Even our a couple of minutes of intro here, I can definitely feel the juice and the energy
Yeah.
that we'll be able to kind of roll out. So, Bill Dean is my name, as it says right there. I've been in the industry since 1995. Getting out of college and just trying to find a job that would, help pay some bills and start figuring out what I was going to do back then. So my first career was really all around child welfare, juvenile justice, just really working in different settings that were more congregate care based.
Okay.
But during that, having some amazing mentors early on, then beginning to just naturally get involved in the industry at that point, allowed me to professionally start develop and grow.
Right.
And from there really started opening different doors. And for me, just opening my eyes to the vast world of true, mental health diagnoses, progress from, access for the most vulnerable, whether that be from the socioeconomics aspect of it, or just some of the learned behaviors in the environments that these individuals had learned and were brought up in. And then at the end of, that first 20 plus year career, I started figuring out, what else can I do? And once I got out of that hamster wheel, because it really was a hamster wheel, right? You're just
you're
running every
absolutely
day. Yeah, running every day for within a business for someone else. It started really opening my eyes to how much more was out there, and for me to be able to get involved in. And so again, fortunately, was able to connect with Morgan Coth out of Ohio and Accentus Health, and take a look at some different culture development and programs that for me at that time was figuring out, how do you take everything you've been doing for 2 decades, how do you connect it to your passion, which for me and our family is athletics, and specifically, for me personally, football, some great coaches in high school and college.
great. It's a great sport for it too.
Yeah, that kept me accountable, and I was fortunate to get through pretty healthy through college. But how do you connect the two? And that's really where I'm sitting at today, is still working in the industry, kind of getting in some different lanes, but also understanding that even 2 decades later, our biggest challenge out there is access for our most vulnerable, appropriate and realistic access for student athletes, for employees of organizations. That access doesn't always have to be about being on somebody's calendar or being on a wait list for a professional to see you. Access can also include, in-hand technology-based resources. We do live in the 21st century now that can promote and support individuals' growth. Like, how can you become a better individual? How can you support yourself a little bit to help you through each day? And then when you do reach that moment where you may need that higher level of care or support, we make sure those resources are around you or in front of you, so that you can access them. And you don't have to wait for 2 months to have access. You can figure out how to access it, quickly. Because when people
that's
are
not access, right? Yeah. I mean, if you got it, like we talked about, if you're having a heart attack, like you gave the great analogy earlier about being, a heart patient, right? If you're somebody under care, like, you've had a heart attack and you're in, you've had the treatment and now you're in kind of care, you're in that, kind of maintenance mode, and somebody who's having a heart attack. It seems right now that we, on the medical side, if you have a heart attack, you get treatment. You go to a hospital and they put you in a gurney and you get like ASAP. But if you're having a mental health crisis, you literally could be told you could, you can see somebody in 2 months.
I think not only literally,
Bananas.
that's the norm. Like, I think
That's just crazy.
Yeah, it's kind of the norm.
It's such a great analogy when you gave that to me earlier. That really kind of hit home. Tell me, what was it like? Take me back. I mean, you're 22 years old. You graduate from college, and you're this is something most people would never see, which is you're in a treatment facility. You're seeing people at their worst moment of a human, and you're a kid.
Yeah.
I mean, what was that like? Did that scare you the fook out of this business?
Actually, it's what kept me in. I mean, yes, it was very eye-opening, and I would say in your face reality. But I mean, I went to school to be, criminal justice major, to be in law enforcement. And but once I started working and seeing that, yes, the most vulnerable, but once you're able to make the connections on support and help and things of that nature, that's really what kind of, and again, having some great professional level mentors to really allow me to start seeing the forest through the trees. But yeah, it is. It's, as a 22, 23, I think I was 23 when I was done. I went an extra semester. I need a little more time to finish all my credits, but it was eye-opening. And you do realize very quickly, outside of the diagnoses and the reasons individuals are in treatment centers for help, there's such a high need for just compassion and relationship development that is every bit as beneficial to an individual as laying on a couch and talking about all your trauma. There's a strong balance of both that helps an individual progress through their treatment. So yeah, that was very, scary, not so much scary, but very eye-opening and in your face reality. Like, oh, this is a real job, because you're not making trinkets, I wasn't making widgets or anything. It was actually interacting with other humans to help them move through life safely. So
yeah, that's just, I just, when you were describing that, I was like, well, how could you, and I get it. You're either going to be run away from that, or you will be attracted to the human connection, empower, seeing somebody get better.
Yeah.
Right. Come out of the facility in a way better, way different place than when they came in. Maybe tell us a little bit about what you're doing now. You've got, this education part, which you and I kind of are bonding on, the belief in the education part and the tools. You're developing some apps and some other stuff. Now that you put it all together, you're on this new road. What's happening? What are you thinking?
Yeah. So really there's two things I'm doing now. And I'll get into the one you just brought up. I'm still in the industry. So I'm the executive director for Unity Point Health Irely Ball, a community mental health center here in central Iowa. Okay. So I spend obviously majority of my time working with that organization and with my team.
And what are they doing there? What does this facility do?
This is open access for all community mental health needs. So we have walk-in clinics, we have in community services. So like IHH, whole health programs. We also offer individualized, one-to-one mental health care. Okay. But then we also, on the flip side, so underneath, and it's a very, very a lot of tentacles coming down from
Yeah,
this
yeah.
umbrella, but ultimately it's supporting our most vulnerable in Central Iowa,
Okay.
Medicaid and different levels of clients and patients, and other community members that need our service. So
Okay.
still very passionate about that. The
Yep.
other side of it, from Accentus Health, Wellness U, Educator Wellness, and our STAR platform. So really, in working with Morgan, who's the CEO of Accentus Health, I took on about a year and a half, 2 years ago, really onboarding operations for organizations. But in partnering with Dr. Yeager out of Ohio State University, created a trauma-informed care wellness resource that was app-based. And
Okay.
really the kind of the initial carve out of it was to support first responders, law enforcement, and medical professionals at the height of COVID. So
Okay.
when
Okay.
anxiety, stressors, you name it, we're at their
Yeah.
highest. Accentus Health was partnering with large organizations to support their employees. When Morgan and I met, we kind of talking about student athletes. He has a very strong passion for athletics and has a history, playing in college, has kids that are involved in sports. So we just kind of started spitballing and talking about the concept of supporting employees in an organization. How do we roll that to supporting student athletes, supporting coaches, supporting athletic directors? Because about that time, we started seeing more and more, social media posts and more stories about student athletes committing suicide, taking their own life, individual kind of worst case scenario stories, right? Assaultive issues that kind of rolled out at like Michigan State University and some other programs. So once all that came out, you start to realize, we need to be looking at how can we support these student athletes and these programs with more access to resources that can help them. And Morgan, he's the brainchild behind all of the intricacy, parts of the app, the resources, the how it flows, how your assessment, and so developing that so it's student athlete specific was very important. But then also on the back end of it was the ability to deliver anonymous student athlete culture reports to leaders at organizations. So not only can you, not only are you, so not only are you helping you as an individual, but based on your feedback to assessment questions and the different stages that we have within the app, then we will pull a report and give it to the athletic director, trainers, strength and conditioning coaches, you name it, whoever's at your stakeholder group team. And then you can start to identify what are our student athletes struggling with? Are there any opportunities around safety, things of that nature? And from there, you can better strategize how you support your student athletes. So it really is, it's mental health, it's a wellness app, it promotes performance and stability for the individual, but it also equips, you mentioned earlier when we were talking, education and knowledge. It equips the leaders with the education and knowledge of what's really going on behind the scenes on their campus. And then it can help them, better move things forward. So that's what we're doing.
That's crazy good. I just immediately think of how good would that be to know that, is my team, where is my team relative to other teams, other football teams around the country?
Mm-hmm. Yeah. And you and I both know your locker room changes every year. Like some of the schools we work with, they have real strong culture reports, but then the following season, they take a dip in some areas. Well, then it allows the coach to look at, or the leaders to look at, did you have a high graduation of some really good kids? Did you bring in some transfers or some new players that maybe aren't on board quite yet, or maybe have a different idea of why they're playing sports? And it doesn't deliver hand wrap the answers to the staff and the leaders, but it definitely says, hey, there's an itch here. We better start scratching it before it becomes a problem. And so it allows them to do year over year comparisons. Where you're strong, you can build on, so you can become even stronger in those areas. And where it's low or there's opportunities, you can much more, rapidly or much
you got to.
quicker zero in on it and try to impact it to move the needle the other way. So,
Well, you imagine the correlation between mental health and whatever, a summation of that would be many things, but a mental health of a team.
Yeah.
Would be probably a lot of things in there, right? The locker room conversations and the sum of the individuals plus the group level, plus a lot. I would think it's a leading indicator. Like if you have a high 90s kind of a health quotient, whatever that would be, you probably have a winning team. And
yeah,
I don't know which one comes first. This would be a great study to do over time.
It is, and we do see that. Like one of the universities we partner with, they're really good in all their sports, and so most of their athletic teams are pretty high.
Yeah.
But most of their athletic teams are competing for conference championships, national championships, playoff qualifiers.
Yeah.
So I don't think it's coincidental that when the higher you are,
definitely not.
No, but the other part too is even, and the culture reports are great, but it's also designed in a way that does not zap the coaches or athletic directors. It doesn't create more workload or take away more time from them, right? Because times you can only have so many hours in a day, right? I think that number's 24. And so the more stuff that coaches and people take on, something always got to give. So we try to deliver the full package so they can really, dissect it and move it forward quickly. But then the other part is every student athlete has that app and they're building their own regimen. And even when they graduate, they keep it so they can use it in relationship development with their spouse or, their partners. They can use it in career development. They can use it in developing, as they start their own family and raising their own children or whatever their story is going to be. What they develop through high school and college in this program, they keep forever. Which again goes back to our first, kind of buzzword or key part is access. How do you always have access to help? So
yeah, like you said, the heart attack is a great example.
Yeah,
I chatted with the gentleman yesterday, the day before, Howie Gerver. I'm taking my little notes. Otherwise, I'm old. And then I'll be interviewing a lot of people in a short period of time.
Yeah, I got mine too, so we're matched.
This is the craziest thing. You got absolutely the same.
Yep. You bet.
I love that. Great minds. He's developed this app. He lost his son to suicide, and and he's a data guy, and so he pours his grief and his hope, to change into this data app. And it's basically it's like a Google search.
Okay.
But it's totally dedicated to all things mental health. And it's frictionless. So there's no payment. There's no, you don't have to put your name in. You don't have to, you're totally anonymous.
Perfect.
Anyway, I think it's an interesting, if you're going through something, you're like, and the weird part is it's like you can be Hispanic, gay, football player in Chile. And you can find a podcast about a gay football Hispanic guy in Chile.
Oh, wow.
Yeah. So he's got this very specific, it's an app, but the search parameters allow you to be very specific to yourself. So you don't have to be a black inner city kid, high schooler, listening to a 55-year-old white guy talk about mental health. You can hear a guy from Atlanta who's black, who's your age, on a podcast talking about it. It was a very interesting guy. And I think that his app or his tool, it's not an app yet. I think it's just a website, but I think it belongs somewhere. It's a piece to another solution somewhere. And he just has,
it goes back to that continuum, right?
Yeah. I will find his home. Like he needs a home. His work needs a home. And eventually I'll find it.
Awesome.
This is a really, I love this idea that you can take it with you, that it's part of your mental health journey, and that you can build on that. I don't even think there's anything related, health-wise. There's no real place that you can actually accumulate your medical history as well, right? I don't think there is anything like this where you can do this on a health app.
Yeah, I mean, my guess is there may be something out there. I mean,
Yeah.
there's some fitness apps and weight loss apps and things like that where you get into the mindfulness part of your journey from a
Mhm.
physical transformation. There's plenty of the rah, right? Wake up early, knock out the world, and that's great
Yeah.
for some people, but not everybody. So my guess is there's probably something very similar within the physical health world. But again, I think it's just more accepting to do those things and talk about those things from a physical health perspective,
Yeah.
right? Like, wow, Ken, you look great. What have you been doing? Oh, I got this awesome app and I'm taking control of my life. Like, that's a normal conversation.
Yes.
If you looked at me and said, hey, Bill, you seem like you're in much better spirits lately, we're getting there, but we're a long ways from me going, you know what? I was struggling from a mental health perspective. I've got this app that gives me daily nudges, daily affirmations that
It's
is
helping. Yeah.
connected to my company, and they take culture reports, and that where I work, I love where I work even more now. And that those conversations, like I said, although they're starting to pick up a little momentum, it's way different than the physical health conversation. And that's what we continue to try and
Yeah.
knock down with our program. So
What do you, I mean, you're around youth. What have you, I think the perception would be that mental health is a crisis. It's gotten a lot worse. What are you seeing with the youth and then maybe wrapped around that, maybe address this conversation. Are young people more open to talking about where they're at mentally, or is it more macho than ever?
I mean, I don't want to be that person that always blames the adults for everything, but as adults, we're really good at screwing most things up for kids.
Absolutely. Yes.
Um, and
Agree.
so I can only speak for my world and the schools that we
Yeah.
work with.
Yeah. Absolutely.
And where people have accepted wellness as a normalized conversation, where they carve out enough meaningful time each day, each week. And when I say meaningful time, it could be as little as 180 seconds, right? 3 minutes to talk about things. I think some of that, that machoism, that vulnerability, or
Yes.
that fear of being vulnerable, that dissipates very quickly because kids look at adults as they increase their trust level in being themselves, knowing how the information they deliver is being received at a very
Okay.
empathetic level.
Yes. Yes.
I think it's, you can accomplish anything. And we do, like at our high school where I'm a coach, once a week in season, we spend 3 minutes, a whole 180 seconds, a week, talking about just some cool things. And a lot of it is I don't talk because, again, as an adult, I will ruin most things if I talk too much. But the kids, as they start
Yes.
sharing things, then when we leave meetings, all of a sudden you hear in the hallway, if you and I are teammates, I look at you and go, hey, Ken, what was that you were looking at again today? Because I'm struggling with that. I need help. The minute we can get our student athletes or in a company, your employees,
Yes.
to start problem solving at a healthy peer-to-peer
At peer
level,
level. Yeah.
then we'll really start to see progress in that. And for me, that's where I think that machoism, that stigma starts to break down. When kids make it okay with each other, young student athletes make it okay with each other to talk about it. It definitely, I don't want to say disappears because there's always an element of fear and vulnerability around anything. But you definitely start to see that positive impact. So we are seeing where we are present, we are seeing that kind of dissipate, and decline a little bit or quite a bit.
Yeah. I love that. I mean, it just makes sense where if you're present on a topic.
Mm-hmm.
Insurance business, we used to there was a funny thing. If what gets measured gets done.
Yes. I
And
love that.
it's such a great antidote. And if you are measuring it and you're tracking it which means you're putting effort in on it, right? If you're measuring
Yeah.
it, something you're putting effort in. So eventually you fix it. I mean, not fix it, but you get some improvement and you're tracking it.
Move the needle.
You're moving the needle.
Mm-hmm.
You're moving the needle. I think that's probably the best place we can spend our efforts right now is the two places. One is schools, kids. I think, kids are, that's the place to give people the skills, and they're hungry for knowledge, are good learners.
Yeah.
They're still open. But finding adults like you that get it, is probably also kind of hard. I'm sure there's a lot of great work being done.
There is.
This is the fun part. I think the work part, you talked about the work part and, being a work person, culturally immersed in corporate world for many years. I like the idea around the work part too. I mean, those same data, the data that you're talking about the mental health of the organization, and it becomes an organism. It's a living, breathing organism, right? These schools.
Yeah.
Same like a corporation. It would be, for me, this was data we would have killed for. I mean, the health and thinking of the company, because you're so many HR programs around teamwork and, bridging the gap between departments and, all this kind of infighting that happens. It's goofy as hell, right? But it's a real thing. But imagine if you could start to see cooperation between departments and people and breaking down barriers through the common knowledge of all of us are pretty vulnerable in the mental health space. I mean, what a great thing to rally around.
Yeah, and think about it, Ken. I mean, we develop our HR and our EAP, our employee assistance programs, which does not promote easy access either. Like, if I'm in a company and I'm struggling with whatever, insert the example, I still have to go to an HR person, say I need help. Then they give you your EAP pamphlet and say call here, and it's anonymous, which great it is. Then I got to go back and I got to make a phone call, and then I start that whole process. Yeah. Like, again, we have made access extremely difficult, but we can check the box to say what? We have an EAP program and we care about you, Ken, as an employee.
I got your back.
Yeah. So it is. And it's the same thing that was really driving us with student athletes. Kids aren't going to go, for the most part, they're not going to walk into a campus wellness center and say, I need help.
No,
because if coach finds out about that, if coach finds out about that, I might lose playing time. I might lose scholarship money. There are things, and most people would say, oh, no, that never happens. We've had enough individuals, hearing it from the horse's mouth that have said, that 100% does happen. So I think access at the employee, corporate, organizational level is every bit as challenging and should be a focus for us as it is at the, student athlete, collegiate, high school level also. So,
and I think I saw somewhere that the amount of money you spend as a corporation on mental health is like a 4-to-1 payback.
Yeah.
Because of time off, illness, lack of focus at work, interconflict with people around them. It's so, I think on the collegiate side, the student side, difficult to make the financials work. It's you do it for the right reasons, and I think the sports part has an angle because of performance and early indicators, and coaches will get it. Harder to see the board or a principal getting their head around it, but definitely a CEO. So I mean, if we're from us looking a place to drive a change, it seems like the businesses could be a real leader because it's a financial driver.
They are. There's a couple schools we work with, though. It's same, right? At a college, though, maybe the CEO's the president of the university.
Yes.
But if they lose 10 student athletes a year to transferring for whatever reason, do the math. If it's a $40,000 a year university, you just lost almost $500,000 in revenue. We call it tuition at the university level. So if they can lower and impact transfer numbers, they can increase freshman orientation numbers. We've got NIL now. We've got all kinds of things going on. They are challenging numbers to measure, but to your point, they are identical. If you can create a
Yeah.
stronger, healthier, happier, more positive culture, it's going to help the business. At the end of the day, it's going to help it. So
There's a direct correlation, especially as
yeah.
I think it's great. Your point about the CEO being the president, and that's a great financial incentive right there.
Mm-hmm.
That's a great financial incentive. And you said even the freshman drop off rate, right? If you could have an impact of 10%, wow, that's a real money. When you add up because those are three, that's 40,000 times 3 years you've lost. Times,
and the big schools, the big schools, the Power Fives of the world, they have their own business models. But when you start really getting into your smaller schools, your 4-year Division III, Division II, NAIA, and community colleges, revenue is connected to the health and survival of these schools is really connected to enrollment, and anything you can do to drive enrollment while creating a healthy culture. It's the same as how do we become the preferred provider to go get a job at where people are happy. And then that does what? That drives the profits of that business. So there are 110 reasons, every day of the week and twice on Sunday as to why this really does matter at those two levels. So
imagine as a parent when you were at the campus and they said, hey, all these good reasons to go to our school. Plus, there's one more thing, which is we have the happiest campus in the country.
Yeah.
I mean, I'd be pretty that's wow. Okay.
Mm-hmm. Yeah. And as a parent,
that's right, as a parent. Right.
Yeah. But I don't know if, Mr. and Mrs. Stearns, I don't know what type of issues you've dealt with your son or daughter. So when you hear, we not only check a box that says we care about your mental health and wellness, but we actually put in front of you and show you how it works.
We're measuring.
When you leave campus, and we've seen this roll out because we've heard about it, when you leave campus, the family looks and goes, that's our place.
Yeah.
They don't even know what we're dealing with, and they put a resource in front of us that we absolutely need.
Yeah.
Now
that
becomes a game changer.
Yeah. We got the tools. We're measuring it. We care about it.
100%. So it's exciting.
Very exciting. Great conversation. I leave all these conversations just kind of a little bit more pumped up and more excited. I'm in the right place.
Yes.
Feel like I'm kind of sneaking in at the right time, meeting so many great people doing positive things.
Mm-hmm.
And this is a great chat. It's given me some really good, clear ideas on the reasons why we need to get on the education and the value and how to articulate that to people. Bill, any closing thoughts? Any advice for me as a kind of a new foundation kid, or any thoughts? Other coaches, closing advice for coaches or administrators, especially around what you've got with the app?
Yeah, I mean, I won't get overly pitchy or too pitchy at all, but I mean, I think that the big piece is you have to really put a true and clear mirror in front of your organization, and you have to be able to ask yourself, if I say, do we offer these programs, and you check the boxes, are you checking it because it feels good and you're just built for short-term success? Or are you really willing to look at it and go, we offer some things, but we could be better. And I want to be better long-term, not just in the next quarter or the next fiscal year or the next season. So really, put that mirror up. And if you don't have full access for your student athletes 24/7, 365, when you're not there for all of your students, or if you're an organization, all of your employees, then there's a lot of cool things out there, tons of cool things out there. So we would say we're the coolest and we're the best, like any good salesman, right? But I would just say, check us out, visit us.
And where do they find you?
Yeah, they can find us at Accentus, ACCENTUS Health, HEALTH.com. They can just put in Wellness U to any LinkedIn or Twitter and find us. You can email me directly at bill@accentushealth.com.
Okay.
But we would love to talk with you, show you example reports of the schools and organizations that we worked with. And then just, you can chew on it and go from there. But the biggest thing is if your employees or your student athletes or students don't have a legitimate way to daily have access without them having to Google YouTube and try anything that pops up, but something that's shared language within your organization, you should really look at that, because I think that's what we need. We need that daily access, or the ability to have that access.
Yeah, I think you need the ability. Great articulation, great story. And once again, the Accentus, ACCENTUS.
Yep, accentushealth.com.
That's great. So go find, go learn a little bit more about that. I'm a huge fan of data. I'm a huge fan of data driving decisions. What gets measured gets done. And I think, if you are focusing on that and you are measuring it and holding people accountable for the results, that number should be improving.
You hope,
yeah. Or, I think at least in the beginning of rolling it out, you're going to find out what your baseline is. Mm-hmm. And, it's good to know where your baseline is and get that information. And then you can find out how to improvement. If nothing else, get involved just to find out where you're at.
Yeah.
And to see what your baseline is, and then make a choice about, how much you want to invest in going forward. Yeah. Bill, thanks again so much. Absolutely. Great conversation. I learned a ton. I really appreciate your time and definitely what you're doing.
I love this. The jar, number one, you got a cool logo. It really is, right? It's the jar. It's cool. Hopefully you got some swag out there. We can get some.
I got a real jar. I have a real jar.
Oh, there you go.
I got a real jar for the other show. Yeah, thanks. It's I'm just following the path right now. Mm-hmm. I'm just following, I'm following the trail. I got a little breadcrumbs on this. I got some breadcrumb trail I'm following on this mental health thing. Yeah. And like I said, just crazy idea. I just had this idea to do this podcast, kind of, thunderstruck. And I'm so glad I just launched right into it. Honestly, I didn't think too much about it. I just did it.
Yeah. Sometimes that's the best way, right? Just go. Yeah.
Absolutely. I'll figure it out later.
Yeah.
I'll figure it out later. Hey, man, have an awesome Saturday.
You also.
Sunday, an awesome Sunday. And I'll talk to you again soon, Bill.
You bet.
Okay.
Let's connect again and have a great day.
Yeah, I'll see you in the backstage real quick here.
Perfect.
Bye, everybody.